Progress.
Well, good afternoon, everyone. Thank you for being here and welcome to the inaugural Cannabis in Sports Conference held here in Orlando, Florida. My name is Dr. Jeff Konin, and I will be the moderator of the first session today. I'd like to thank my colleagues, Gene and Dana Jones, for helping us put on this program. We're going to get right into the program and started with our first panel. And this panel is titled The Voices of Coaches, Athletes, and Doctors. And it will be a moderated roundtable discussion. So first, I'd like to briefly introduce our panelists and allow them to spend a minute or two to introduce themselves and their background. So first is Dr. Derrick DeSilva.
Well, good afternoon. I literally just got off a plane, 2-hour delay, so don't fly anywhere. I'm from New Jersey. I'm a medical doctor. I'm an internist. I've been working in this space for about 10 years. I do a lot of product development. I teach at both the medical schools in New Jersey, and my real area of expertise is age management medicine or anti-aging medicine, a lot of nutrient supplements. I really believe that that has to become part of what we do in order to really achieve wellness. And it's a pleasure to be here. Thank you very much for the invitation.
Thank you, Dr. DeSilva. I'd like to welcome Anna Valent.
Hello, I'm Anna Valent. I'm the Executive Director at Athletes for Care. We are a nonprofit organization. We've been around for about 5 years. We just passed our 5th anniversary. We work with athletes during and after a career in sport, focused on making sports safer for athletes of all ages. And a big part of that is plant-based medicine. We do a lot of work in cannabis from the research side to connecting athletes with resources and medical professionals that can help them deal with some of the injuries and mental health issues that go along with a career in sport.
Thanks, Anna. Dr. Torrance Williams.
Good afternoon. I'd just like to say thanks, Dr. Konin, for the invite and for the Cannabis Sports Conference for the invite as well. I certainly do appreciate it. So my background, basically what I do is I'm an athletic trainer. That's kind of what I do. In fact, before I got here today, I was working at an athletic training event. However, I also teach. I am a program director at Bethune-Cookman University, which is in Daytona Beach, about an hour away from here. And my research background is mostly in the sickle cell trait and athletics. And I'm certainly not an expert in cannabis and sports medicine, but I am very intrigued by the subject. So I'm just very happy to be here.
Thanks, Torrance. And of course, last but not least, Kaitlyn Verfuerth.
Hi there, thank you. It's an honor to be here. I'm a 4-time Paralympian in wheelchair tennis, and in this last Paralympics, I went in Tokyo and I competed in sprint, kayak, and canoe. I'm also a recreational therapist at Ability 360, which is a nonprofit out in Phoenix where we serve people with varying disabilities. And I'm also a wheelchair tennis coach, and I serve about 40 players in the Phoenix Valley.
Thank you. So before we get into the science piece of this and the aspect of how each of our panelists views where cannabis is headed in the sports industry, I want to ask each of you a question. In my travels, each person that I come across has a story. In other words, if I found you 20 years ago, we might not be talking about this same topic. So what I'm curious is, how did your story start? In other words, when did you get introduced to the space of cannabis, and how did it intrigue you to the point where you're sitting here today as part of this panel? Can we start with you, Anna?
Sure, absolutely. So growing up, I was a swimmer, a competitive swimmer, and went to the University of Florida to be a distance swimmer. Right, go Gators! We're down here in Gator country. But I was a distance swimmer, which I don't know if you guys understand the difference between sprinters and distance swimmers. Sprinters are very tall and have a lot of fast twitch muscles and can get to the other end of the pool very quickly, whereas distance swimmers swim really slowly for a very long time, and everybody else just gets out of the pool. And so lots of overuse injuries and things like that in my background. And then fast forward from finishing my swimming career in 2003, I became familiar with Athletes for Care about a little over 4 years ago when I was invited to be their executive director, and really kind of understanding the transition out of sport and that atmosphere where you're going from always being this one thing to being you don't even know what next. I still go home to a small town in Georgia where people ask me how swimming is going, and I haven't been in a pool in 20 years. But when I got involved with Athletes for Care, I started to really understand how cannabis can help not only that transition that includes depression, anxiety, people coming out of high-impact sports. It also includes, PTSD and identity crisis, things like that. It can also help with the long-term pain management of overuse injuries, impact injuries, as well as repairing brain damage and the causes of impact sports.
Kaitlyn, I see you shaking your head feverishly down there. You want to jump onto that with some thoughts?
I actually do. So I actually met Anna from Athletes for Care. I was competing in the Paralympics, and in 2016, I did my last wheelchair tennis run in Rio, and I was taking 7 different medications to help with just overall overuse of my shoulders. I've been in a wheelchair since I was 7 years old. I was involved in a motor vehicle accident. And so, my shoulders are my legs, and your shoulders aren't supposed to be your legs. So actually, I just had shoulder surgery about 4 months ago, and I'm still recovering. And what I found is that cannabis works. Like I said, those side effects of taking those other drugs that I was taking caused such dry mouth, dry eyes, just my stomach was always upset. After I came back from the Paralympics in Rio, I went and got my medical card, and I was sick and tired of taking all these meds, and now I only take one medication for a little bit for anxiety. It's just like Lexapro. And then everything else I'm able to manage through whether it's CBD or CBN or CBG. And I just find that using the spectrum of the plant has completely and totally changed my life. I haven't even filled any pain meds when I had my surgery from my rotator cuff back in March. So for me, this drug has changed my life, and it's only changed it for the better. And especially for folks in the disability community, people with neurological disorders is huge. Just everything from phantom pains to muscle spasms to things that I've been dealing with my whole entire life. Using cannabis has changed all that for me, and it's super exciting.
I think you bring up some interesting points, and as you describe various cannabinoids, we'll spend this weekend talking about the differences between many of them, and whereas some individuals will benefit from THC, and some will view THC as being harmful to what they're doing, whereas others don't necessarily need a THC component. They can benefit from CBD and CBN and others, as you had mentioned. Dr. DeSilva, as a physician, what was your story? How did you come into this space?
About 10 years ago, I've been working in the world of integrative medicine, as I said. This is my 35th year in clinical practice. And I've been doing this a long time. From the very beginning, I've always believed that using prescription drugs, if you come in to see me and you've got a fever of 102 and you've got an infiltrator on your chest x-ray and you've got a white blood cell count, I'm not going to send you home an echinacea and vitamin C. I'm going to put you in the hospital and give you an IV and put you on IV antibiotics. On the other hand, if you come into the hospital and you're in the emergency room or you just come into my office and you've got a cold or a flu, yeah, I'll try some vitamin C and I'll try some echinacea. And that's the way I've been doing medicine for the past 30 years. The world of botanicals is, my father, by the way, is a botanist. So it's epigenetically programmed into my genes to do that. But the world of botanical medicine and the world of integrative medicine across the board is, the beauty of it is, and let me give you a great example on this, omega-3s, fish oil. You can come in and you can take fish oil because your cholesterol is elevated and your triglycerides are elevated and you don't want to take a statin. Or you can come in and say to me, I want to take some fish oil because my joints are aching, and I hear that fish oil is really good for the joints. Well, that's true. Botanical medicine, and this is what I've always believed, is that it has side benefits versus side effects. And it's the same thing when it comes to cannabis. I may want to use it in a patient of mine because I see that they have joint pain. Well, great, I'm going to give it to you for your pain. And by the way, we just published a study in Clinics in Medicine on the inflammatory markers that come down when it comes to full spectrum hemp oil. By the way, and then you give it to somebody for the joints, they say, you know what, I feel better. I feel calmer. I was really anxious, I was really nervous, and it's making me feel better. So the applications are so broad. And as Anna mentioned, everything from, and also as Kaitlyn mentioned, the spectrum of what this does, to me, was intriguing. And 10 years ago, I said, wait a minute, you mean I can use one thing to treat somebody that has anxiety, depression, joint problems, sleep issues? That's pretty awesome. And that's how I really got involved in it, looking into it. And then product development, my big thing is delivery systems. I have to make sure that whatever I'm giving you as far as a delivery system goes, that it's going to get into your system. So I've always worked on delivery systems, and that's what I've developed with some of the things that I've done. So a phenomenal plant. I call it, many years ago when I started this, I said, I called this God's multivitamin, because it literally has so many nutrients. It has so many omega-3s. Full spectrum hemp oil has more omega-3s than fish oil. I don't know if you know that. Most omega-3s have between 4 and 6 fatty acids. Full spectrum hemp oil has over 8. So the benefits and the mechanisms of how this works can all be explained. And I just love working with it.
The cannabis industry from a therapeutic perspective has grown in a unique way, whereas many other advancements that we see come from science and education. Here, I would argue that it's been patients who have been advocating and pushing for the legislative changes that we've seen, and that the science hasn't even really caught up to the reality and the practicality of where we are right now. And one of the challenges that I face, amongst many, is education. So, Dr. Williams, you and I both work in universities, and we know that they're not necessarily the most progressive places to be with changes. So talk to us about, at least from your experience, what's being taught to your knowledge.
Well, I'll tell you what, I'm definitely going to be adding this. We have a class called Current Issues in Athletic Training, and I think this would be very beneficial to teach our students, about cannabis usage. But as far as now, this is going to be a hard sell for, like you said, because most universities resist change. And especially in my school, we're a faith-based school, so that's going to be even a bigger challenge when it comes to the taboo of cannabis. And, obviously at a university, we have to also think about athletics and NCAA violations and things like that, which it is still banned there. So it is definitely is going to be an uphill battle and a challenge to try to convince those folks, especially the NCAA or the IOC or whatever, to change their mind or see the broader spectrum of using cannabis in sports medicine.
So one of the topics I want to talk about right away, because when I travel to cannabis-related conferences, oftentimes what I see is how I phrase it, that everyone's drinking the Kool-Aid. When you go there, everybody's pro-cannabis in every way, shape, or form. And we'll certainly hear plenty of that here this weekend about the benefits in various aspects, and you've all already alluded to some of that. Let's also start right out of the chute about concerns. What are the concerns? Those that are against, what are you hearing? And from your viewpoints in working with patients, working with athletes, teaching, what are the concerns that are out there with any aspect of any of the cannabinoids? Dr. Silva, would you start?
I think the major concern is, as you alluded to, is the lack of knowledge. You know, at the last conference that we did here a couple of months ago, one of the things that I said was the educational aspect of this is critical. And there were some legislators that were here in the audience as part of that. But I think it's still the stigmata, as you mentioned, is, you know, you said faith-based. Well, I mean, didn't God make this plant? You know, 25% of all drugs are from plants. 25%. That is a lot of drugs, prescription medicines that are from plants. I think the biggest concern that I have seen is the stigmata that comes with whether it be THC, CBD, and people still don't understand the difference between THC and CBD. You know, wait a minute, am I going to get high from that? You know, and for me, it's full spectrum hemp oil, right? It's the cannabinoids. So for me, I think in my own practice, within the hospital, within the physicians, within the hospital, it's lack of education. It's information. I think that's where our biggest hurdle is.
Kaitlyn, Dr. Williams alluded to the IOC and NCAA and, you know, perhaps WADA and others. We'll have individuals here during the weekend who are going to talk about drug testing, what they see, and I'm guessing you didn't try to bring anything and slip it in your bag when you were heading over to the games at any point in time, but
Actually,
you did. No, don't admit that if you did.
Actually, no. I remember going to Tokyo because when I reached out to Anna at Athletes for Care, the only way that I could still compete was if I had a therapeutic use exemption form, which is a TUE. And the only way to get a TUE for medical marijuana is if you have a neurological condition. So I automatically was able to fall under that because of my spinal cord injury. However, Tokyo does not allow medical or marijuana whatsoever. It's completely illegal. So no, I didn't take anything over there with me. However, it was difficult because I knew training here, I had to, I think the month of July, I started slowly weaning off, and I went back onto some of the medications that I was taking, and I was having horrible side effects and wasn't sleeping good anymore. So I could really tell there was a big difference. And then even when I got to the games, I could tell my performance wasn't as great because I had switched back to all these medications and I wasn't feeling awesome.
So what is that like when you're training a certain way in a certain regimen with all the pieces of the puzzle that you rely on,
Yeah.
and then you go to the biggest event of your life
So-
and you have to do something completely different?
So I feel like I'm really, maybe a couple other athletes like myself use medical cannabis, and I was able to, you know, kind of meet up with a few of them in the village, and we had talked about it. And there was an athlete from Canada that I met, and you know, he kind of did the same thing. We met on this other forum online, and we all started slowly weaning off because we couldn't take our drugs. So we all felt like we didn't perform as best as we could, and I feel like there's a big hole, like that I do think it comes down to stigma and education. And I think that also, even being here, like, there's certain people are like, I wouldn't reach out to my U.S. coach and be like, oh, I'm going to go talk to this cannabis conference. They would be like, I feel like, you know, then people are placing judgment on you, but it's not about that, you know. I'm not an athlete. I'm not a pothead that's an athlete. No way would I ever get stoned or get super high and get in my kayak and go race on water in my nuts. Like, just doesn't make sense. So I don't also see how, you know, some people believe that cannabis can enhance your performance. I never felt that way. I do understand how it could relax you a little bit and get you more into that moment. Maybe that is something that could be a concern in the sports realm. That would be, just when we were talking about concerns, that was one thing that popped up in my head because I know you're a little bit more relaxed, and when you have a little bit more relaxed, you have a better serve, you have more topspin, you're not afraid to hit the lines, you know. So
Sounds like a research study.
I think it's a research study. I feel like though there's not many athletes out there that are very vocal about it. So
So when we talk about in this case, I think you're alluding to THC, from a therapeutic standpoint, we're not talking about overdosing, if you will, but a small amount that, just like we would take a medication that's prescribed from a pharmacy, we don't take the whole jar, you take the pills amount that's prescribed, right? So Dr. DeSilva, is there a concern from that standpoint? Is THC addictive?
You know, there seems to be some issue with that, from what I have seen. There seems to be a little bit of tolerance, so you may need a little bit more. But here's the one thing that I get concerned about with THC, heavy use of THC. There are certain, and I have seen this in my own practice, there are some people that have come in, and I know that they're very heavy users. Now, heavy for me is different than heavy for you, depending on body weight, BMI, et cetera, et cetera. So the one thing that we see that I think we have to be cautious with is cardiac, some of the cardiac manifestations. You can have and you can trigger some cardiac arrhythmias, some dangerous cardiac arrhythmias with overuse and long-term use of THC. Now, again, differentiation between THC and full-spectrum hemp oil, okay? Because if you're looking at less than 0.3%, that's not an issue. But if you're looking at 0.5 to 3 milligrams, and it goes even higher, and some people do a lot higher dose than that over a long period of time, yes, you can have some cardiac manifestations. Now, the question on that is why? Why does that happen? The thing that I have seen that I have made note of is that no matter what synthetic drug you ingest, put into your body, it could be Tylenol, every single synthetic substance that you put into your body will deplete the body of a nutrient, without exception. The nutrient depletion, I think, is what causes the problem. So as you could, because it doesn't happen right away. You know, it doesn't happen in a year, it doesn't happen in 2 years, it happens in 10 to 15 years. So I think that there is a depletion of micro and macronutrients that triggers these kind of cardiac issues. That's the big thing that I've seen, you know, long term.
Anna, when you were swimming in college, where were your views on this topic, and how have they changed from then till now?
When I was swimming in college, cannabis was a party situation. It wasn't, you know, something anyone was doing for their health or even pretending to. You know, that hadn't crossed anybody's mind. It was more just trying to, you know, figure out the drug testing and how you know, get through that. Because also, you know, cannabis, that is one of the concerns, is it's not like alcohol where if I have too many drinks and I get in a car, you can do a breathalyzer and it blows a certain amount, cut and dry, you know, shouldn't be behind the wheel, whatever. Cannabis stays in your system for a long time, and a lot of people use it, they're microdosing, they're never high, they're never inhibited in any kind of way, but it builds up kind of in your system. It also, you know, you were talking about, you know, your body makeup, it's stored in fat cells, so you're like a female, typically has a higher, you know, body mass fat ratio, they will store more and test positive, you know, sooner. So, you know, we were just more concerned with that. Now, looking at it, you know, I really understand a lot more about the uses and how it's actually so much better than, you know, the Advil and Tylenol that they were giving us to manage inflammation and pain. You know, we could have been using CBD and things like that, and it would have been a much healthier option.
My brain is still processing the tennis topspin and THC study that we're going to do in the future. So we at least have one subject who's volunteered to participate. I think I heard that, right?
We can do a research.
There's a really nice tennis center here.
I know.
USTA.
I'll write the protocol.
Okay, perfect.
Dr. Williams, I have a question for you. So you said that it's time for you to implement this into your curriculum right now.
Absolutely.
Okay. And I think that's great. You have to start someplace, right? But when I went to school, a year or two ago, when we learned about, did you laugh? When we learned about the nervous system, it wasn't a 1-hour lecture. And when we learned about the endocrine system, it wasn't a 1-hour lecture. So what will you cover in the endocannabinoid system or any other aspect of this in a 1-hour lecture?
Well, I think you have to give them the whole gamut. I think you have to give them the good, bad, and the ugly. We have to talk about the risk and the benefits. We know that there's so many benefits, as I think everybody in this room would probably appreciate. But there are some risks as well that I see in athletic training. One, I know there's so many different ways to take these drugs. But the one concern that I do have as for our younger athletes is what is it, as far as smoking marijuana, what is it doing to their lungs? Long term, what is it doing to their lungs? Also, as far as, I can see how in certain sports it may benefit, like maybe since it's the calming effect, archery. Or something like that, maybe weightlifting. Michael Phelps said it's worked great for him with swimming. So, but I wonder about those sports like baseball, with the hand-eye coordination, or as a shortstop, since it's calming you down. Well, can you move as fast? Will that cause, with a bad hop, will that cause an injury? What about, since it's a calming effect as well, what about your linebackers in football? Since they're moving maybe possibly slower, and of course I don't know if there's not enough literature on this as far as I know. What is that doing if someone else is running full speed, and because of the calming effects, you may not be moving as fast, or so that I have to consider that as well. So I think, as far as teaching, give them the risk, give them the benefits. I think the benefits, far outweigh the risk, but I think there are some risks as well. Maybe Dr. Derrick, you can kind of talk about that.
Well, again, I never thought of it that way. I really haven't, and I've been doing this a long time. I never thought of it as, somebody, a ball coming at you, a 95-mile-an-hour fastball coming at you and thinking, woo, man, this is really coming at me. I mean, it's coming at you. Like, you got to get out of the way, or you're going to get creamed. Or a linebacker. I mean, I don't know. Does it really change reaction time? That's really the question, and then that's something that I think we really need to look at. I honestly don't know. I don't know that it would change reaction time to the detriment. I think that it would probably, if it did change reaction time, I think it would be, I don't think it would hurt you in any way, shape, or form.
I just want to chime in on this reaction time topic, because when you're a professional athlete and you've been playing your sport, and how many gazillion hours have you hit that forehand over and over and over and over again? Even if I was impaired, like my body, as soon as I see that ball coming, my body just automatically reacts. So that is I've never thought about it either in that regard. So I'm really thinking about, like, if I was, I don't know. I don't know. I feel like it would relax you more and let you really fully take on the ball and hit a ton. That's what I've noticed when I've microdosed and maybe compete and played some tennis or given a lesson or something like that if I was in pain, but I never.
A lot of our athletes say it helps them focus more.
Yeah.
It really helps them zero in and laser focus and actually tune out a lot of what's going on around them. So, I think if you're more focused, I don't know how it could really impact your reaction time as much. And I think that's really where a lot of the concern within sports comes into play. As in our world of Western medicine, we're used to take, this pill this many times a day for this many days, and you are cured. Cannabis is so much more of an individualized thing and trial and error, and it's not just how much, it's delivery method, it's strain, it's all of the things, and what works for me may not work at all for Kaitlyn. You know, I may be taking something to sleep and it keeps her awake. I may be taking it to, you know, eat more, and it may make her not want to eat. Exact same thing, exact same delivery method. It's so personalized, and I think that's where one of the major issues is in sports is how, if you are an actively competing athlete, at what point do you go through this trial and error method, assuming it is fine and you're not going to have any drug tests and things like that. But even once it's allowed, how do you take these fine-tuned athletes and go through this trial and error process when they're having surgery in a week so that they can do that instead of opioids, right? Now, in theory, then, with surgery, they're going through a recovery period and all that, but you see what I'm saying.
So, Dr. Williams, you opened up a can of worms, this reaction time. And this is a topic that's near and dear to my heart in studying the literature here. And if you actually look, there are studies that look at reaction time, but unfortunately they're not done on athletes. They're certainly not done on competitive athletes in NCAA for a number of reasons, because no one's going to allow them to participate in that study, and as you mentioned, it's still banned by NCAA. And other athletes who are actively competing are reluctant to participate in certain studies. The studies that are done have been done on average individuals, mostly in college settings, who have used high doses, significantly high doses chronically over a period of time, and they've measured things ranging from reaction times to GPAs, lots of different things. These are the studies that are often cited by the NCAA for the past decade or so that have said marijuana's bad, marijuana's bad, marijuana's bad. Look at all these studies that show that. They really never focused, if you look at the methodologies of the subjects that were in the studies, they weren't the population of student athletes at those elite levels. So let me toss another question out to you just to increase the controversy on this topic. For those of you not aware, the NCAA just changed its policy. So cannabis, it says all cannabinoids are banned. That's their policy as of yesterday and as of tomorrow. However, a positive test level was at 35 mgs per ml. It's now 150. It went up almost fivefold in alignment with WADA. However, they didn't clarify where non-THC fits on this. They say it's with WADA, but WADA has exempted CBD. So my question to you is, it's technically still banned in the NCAA, but you can have up to 150 in your system. Is this a license to smoke? How will this impact, in your mind, changes in the future of collegiate athletes? Because the reason they raised these levels was, as many of you said, it's not a performance-enhancing drug. It's not recognized as that. So therefore, the purpose of the NCAA is to keep a level playing field, right? So they weren't worried about this. But they raised it, but they kept it banned. So what does that mean?
I think it has to do with recovery. Like, after if you've had a training camp and you come home, you're exhausted, your body's beat up, I need at least a couple days to recuperate, to recover, and I've always felt like cannabis was the best way for my body to recover and handle the pain or whatever my body, the trauma that just it went through. And I know a lot of athletes during their downtime are using cannabis to help recover. So I think that's why I think, as an athlete, why they've raised it.
Can you elaborate on that? When you say recover, does that mean reduce potential muscle soreness post-activity, increase sleep?
All the above. So help you sleep, help with muscle spasms, muscle soreness. I know it helps me in all these areas. Definitely sleep, and then I just feel that when I come home from these training camps and I have that time to recover, maybe laying on the couch is difficult for somebody like me. I'm very full of energy and I want to do things, and that really helps me stay calm and calm down and let my body really heal and do what it needs to do for a couple days.
Thanks. Dr. DeSilva?
Oh, go ahead.
No, go. You pull the mic up.
I was just going to say, athletes who are in their careers and are trying to reach the top and reach the next level and win all the things that they can win are very rarely going to actively be trying to ruin their careers, right? So if they are using cannabis they are using it because they believe it helps them or it does something to allow them to feel better. I don't think that they're going to just be sitting around trying to be as stoned as humanly possible for all the days. Now, they may choose that as their, Friday evening relaxation tool, which, arguably would be healthier for them than alcohol, which is, by the way, not banned, and it is tested for, but you would have to be drunk at your 6 a.m. drug test to test positive for it. So, that's where I think there's, raising the limits has really helped athletes start to be able to use this as a tool.
I think raising the limits is telling the public, we don't know what to do. I think that's what it comes down to. We're going to raise it. You guys can do what you want. Just don't go over that number, which is a magic number, as we all know, where the 0.3 came from. It was just an arbitrary magic number that was put out there with the THC. And I think that's what they're doing, is they're just hedging because they're under pressure to do something.
I think I want to emphasize what you just said. It's one of my favorite articles on this topic. It was published in 1976 by two individuals who were doing a cannabis study. And they said, for arbitrary purposes, we will define hemp as 0.3%. Yes. And I was recently in Italy consulting on this topic. We walked into a store and I picked a product up and it said 0.5%. So they have a different number that they follow in that country, and I realized this is kind of neat. I'd love to take it home and show everyone, but it's actually over the limits if I were to come through these borders. So the number is completely arbitrary. You're absolutely right, and it's pretty much the same reason why we have 150 as the number for sensitivity of testing, completely arbitrary. You have no idea what that means.
I got a question for you, Dr. Konin. So with WADA, is that during competition, or is that the testing year-round? Are you
Championship testing.
championship testing?
Competition, correct.
Only in competition. Okay. So, so they're saying, I guess it's okay if you do it year-round, just when you're competing.
Just don't come here after you win.
Okay. Just want to clarify
We
that.
chase you around before you get your medal, and then we test you and see what happens before we give you the medal base. Actually, they give you the medal, and then you can take it away afterwards, right, a few days later.
But one of the major problems with testing at any level is the same issues that the general population runs into when they go see their medical professional. When an athlete goes to their athletic trainer, they're not going to be honest about what they've been doing, right? And so then their athletic trainers, their sports medicine physicians, they are prescribing other things to treat things, and there is no consideration of drug interactions or how, this is going to amplify or reduce the effectiveness of other things that they're doing to treat these athletes. And so as long as you're testing, you cannot say to your athletic trainer, I'm actually treating my pain with cannabis, and so then just like people lie about their alcohol usage to their doctors, right? You have to kind of assume there's a little fudge factor in there. But that's a key part of getting rid of the testing, is so we can discuss this openly and do what's best for athletes.
And you raise a great point. I think that's where we talked about education earlier. If there's one place that we can make a big change, it's to open dialogue and encourage athletes to be transparent and seek consultation. Because as you said in the past, when it's banned, they're not telling you they're using it because they're not supposed to, and they're doing everything in their power to mask it within the rules of how they can mask it, right? But they come and they ask about nutritional supplements. They'll speak to the dietitian. They'll speak to anybody else about something to put in their body, not this. I think, for example, in Major League Baseball, stop testing. Other sports don't test and hold accountable anymore. And now the NCAA with these changes. I think what it really does is hopefully opens a door for the athlete to come to the athletic trainer, to come to the team physician, to come to whoever is in their trusted organization to ask them questions. The questions could be, am I getting it from a safe place, right? Those are real issues nowadays with fentanyl on the streets. And what is this? How do I know what's in this that I'm putting into my body, just like I need to know if I'm putting anything else in my body? But part of that open dialogue also requires the educators on the other end that are receiving those questions to have knowledge. You have to be able to answer these questions or know where to refer them to give them information, right? Because you can't say, number one, I don't know, because then they'll just go ask someone down the street or someone in a text message box. You can't say, oh, no, that's really, really bad, and have an antiquated approach to it. You have to be able to connect with them, give them an answer, or refer them to someone in the right place. We'll take some questions now. I cannot miss you in the back. I see you. Dr. Gordon, you are more than welcome to jump in here. We have a microphone for you, actually.
Oh,
I didn't think
he
so.
doesn't need a microphone. He's good. I'll record.
Yeah, hey everybody, Dr. Barry Gordon. I'll be speaking tomorrow. But I wanted to pop in on this topic, Jeff. I have an entire lecture on my computer called How to Talk to Your Doctor About Medical Cannabis, or in this case, your athletic trainer, okay? The person that you don't know how they view medical cannabis, even though you're already using it. So my suggestion is always to keep it in the third person. Don't implicate yourself. I tell my patients, say to your primary care physician, do you have any patients in the medical cannabis program? How do you feel about the medical cannabis program, right? A couple other ways you can put it too. But if you open it up for him to give his opinion on it, then it's going to be one of three answers these days. The first answer, much less so than 5 years ago. First answer, pot, dope, weed, grass. Who would do it? Can't believe it. Can't imagine anybody do it. Then you know what? You're going to shut your mouth. That's not a doctor you're going to bring that up to. You're going to continue to use him for the purposes that you use him, be it your blood pressure meds, whatever it may be. Second answer, much more common, would be, you know what? I didn't learn it in med school. I know there's a lot of people doing it, but I can't do it yet. Believe it or not, hospital systems stop doctors from doing it. So the neurologists, the GI guys, the guys you think would do it because their qualified conditions qualify here in Florida, they can't do it because the hospitals won't give them privileges, right? So they rely on inpatient referrals for a lot of their business. So they refer their patients to me. But the point is, there's a lot of reasons guys won't do it. Not learning it in med school and being comfortable financially being two primary reasons. If you have good active practice and you're at risk from the DEA, from your attorney, from your partner saying you're nuts, then you know what? You're probably not going to do it. That's why we're losing doctors in Florida right now, not gaining them to the extent of the program, and that's pretty sad. The third and best answer would be that, you know what, I don't do it, I do believe in it, and that Dr. Barry over there, he's the best guy in town, go over and see him. So that's what I suggest to new doctors doing medical cannabis is make sure the doctors in your area that know you already or that don't know you know that you're out there providing that service. But just getting back to the point, when you bring it up to your trainer in that environment, it's best to leave yourself out of the conversation and just open it up to get kind of the prevailing opinion, in the house, so to speak. If that makes sense.
Thank you. Any other questions?
Thank you. I'm Jeff Tinas with Summa Forte. And first of all, thanks to the panel. Just an incredible start for this conversation over the weekend. So we're a new brand in the market, and we're bumping up against another actor that I don't believe has been mentioned yet in the conversation, and yet they play a key role in what athletes can or can't use, and that's NSF. So this not-for-profit monopoly, essentially, if you want to have institutional endorsement in an athletic environment of your brand, has to have the NSFS certification. That's true at the NCAA level, and it's true in professional sports. And it's a very non-transparent organization. We're going through something right now with them. The reason I'm here late is because I was on the phone with our attorneys. And so I'd like to hear your comments, like when you talk about WADA. So WADA, says THC is banned, synthetic or natural THC. Then they have the exception for cannabidiol, which is our products, CBD. they leave the other 100 and some minor cannabinoids unaddressed. I've had recent conversations with Dr. Olivier Rabat at WADA about this. And so they're saying no THC. They don't say whether that means below the 0.3% or the 0.5% in Italy or where. And NSF doesn't test for performance-enhancing drugs. They test for whether or not a drug is detectable. That's what they're explaining to us now. So actually, they claim to have found 1/500th of 0.3% in one of our lots, and are, telling us that we failed. So I'd just like to know if any of you have some insights that you can share on NSF, because it's actually a very real problem that we're addressing right now. Thank you.
Is there anything you want to add that he didn't already say? I think that's the trifecta, right? There's the 0.3, there's the 150, and there's the NSF. I mean, unfortunately, what you're up against is collective bargaining agreements that are somewhat antiquated because they're written into those agreements as to what individuals can or can't use, in depending which league and association they're a part of. You're absolutely right. It's not only difficult, it's expensive to go through NSF. In some places, it only pertains to nutritional supplements, and so you can use various topics or various products topical and not have to go through them. So it depends on which products are out there and which organizations you're trying to apply the product to. Does anybody else have any thoughts on NSF?
You don't want to hear my thoughts.
No, I didn't think so. I'm trying to be politically correct.
We do.
The politics of medicine is sinful. It is so wrong. It is so unjust. It's like getting a seal on your Kellogg's box from the American Heart Association. How much money you got? That's what it comes down to. Now, is it all like that? No. There needs to be some regulation, but there needs to be some transparency in regulation. When you look at, I'm in the process of going through something right now with another botanical with the FDA. The paperwork and the money is just monumental. There needs to be a simple, this is not going to happen, okay? I'm just talking for the sake of saying something. There needs to be a simple process that everybody goes through. I can use CoQ10, but you can't use N-acetylcysteine, because N-acetylcysteine is kind of a drug, and we're not sure what the FDA is going to do with that. So it's just so convoluted, and it's so messed up, and it's so wrong that I think the athletes are suffering. Not only athletes, because athletes have a different, and I'm sorry to say this, but they have a different threshold, right? In New York City, I forget the basketball player. You don't need the vaccine. It's okay for you. But all the firemen and policemen and all of the people that were fired because they didn't get the vaccine, it's not okay for them. So where do we draw the line? We draw the line at money. And that's unfortunate as what's happening. And for the regular people, and again, this is off topic, but for regular people that really need this, that really benefit from this, and you go back on 3 drugs versus not taking one, I mean, come on. I don't know what the solution is. I don't get involved in that. I don't want anything to do with that, because I'll die trying to do something with them. It's horrible.
Well, and I think that is too the catch-22 of legalization, right? Everybody wants legalization. We want federal legalization. With that is going to come a lot of red tape and a lot of arbitrary regulations. Now, some testing, some regulation would be helpful, because if you just look at CBD products, now they're legal. you can get a CBD product that has no CBD in it. It's just some random oil that you can get in a gas station for $5 for a little bottle, or you can buy, you know, a $120 bottle that actually is a quality product and quality CBD, and price doesn't necessarily identify whether or not it's a quality product. And so how does the average consumer choose the products? And then unfortunately the system to get there is a little convoluted and financially benefiting certain people.
Can we segue into that topic about how does, not just the average consumer, but let's talk about the athlete. How do you decide and decipher between the many products that are out there? Because no offense to 7-Eleven, but I advise people not to choose that at their location of where they would pick up their CBD.
Or their sushi.
Right, right.
I prefer the gas station.
The gas stations. Yes, the longer it's been on the shelf, the better.
Yes, the longer the better.
Right?
And the fumes are better,
Yeah.
you know, it's more, it's part of the natural environment.
Yeah.
So we have dispensaries, we have different rules in the state of Florida as we do in California, incredibly different. So how do you advise athletes, and Kaitlyn, from your perspective, how would you advise fellow athletes where to start?
That is tough, because like my doubles player lives here in Florida, and you know, when I first talked about when I was gonna retire and get a medical card, and she thought I was nuts. She's like, why would you do that? You're risking, like, if you ever wanted to get back into sport, like, you're not the stigma and people viewing me as a pothead, and that is hard. For me, all I can do to my fellow athletes is share my stories. And, you know, last summer I was training for Tokyo. I had a cracked rib. I didn't go to the gas station, but I went to a CBD store actually, and I spent $150 some on this oil, this tincture, and I couldn't believe it. Like, I had that like nerve pain I had was gone. After 2 days, gone, and I just took it religiously every morning, and I could go back to training again. And I shared that with other people, and then, you know, probably wasn't supposed to do this, but I would bring some samples for my other fellow athletes, and be like, oh, you know, my shoulder's bugging me, or, you know, my wrist is really hurt, like, try this, or put some topical, like, put this on. Wow, that really works. I don't know if it's a placebo effect, or, I mean, that could also go into your brain, but it's tough because of the stigma and because it is so frowned upon. And the drug testing, I mean, we as athletes, our hands are literally tied behind our backs when it comes down to drug testing. Like, that is the end of all. If you get tested positive and you are out, you're done. In tennis, it's 4 years suspension.
Well, and speaking of testing, it's not just THC. There's
No.
millions of other things they're testing for, which may be in that product that
True.
it doesn't say anything about.
That's also
Maria Sharapova.
Maria Sharapova.
Yeah.
There's so many stories about other drugs, or talking about supplements. Supplements as well. Like, I know, like USADA and WADA, they do every year, or when you're a high-level elite athlete, you have to submit your whereabouts every single day for each quarter, and you also have to submit what you take, and you know, a lot of those the supplements. I know I have a lot of friends that went down because of maybe had something in it that obviously they couldn't have while they were competing. So it's not just. There's a lot of things that go into play. I feel like I danced around that.
Well, here's what I tell my patients. And this is what I tell, again, patients, competitive athletes, professional athletes. Find a company you trust. It could be, and I'm talking about dietary supplements, right? And I'm talking about full spectrum hemp oil. Find a company you trust. For example, the QR code. The QR code on most boxes of full spectrum hemp oil, I know the ones that I've worked with, you take your phone and you take a picture of it, you shine it on the QR code, and it will give you the analysis. It will tell you, right, things like, you're not going to put a company is not going to put a QR code when there's garbage in it, when it says full spectrum and all you have is an isolate of CBD, right? So find a company you trust, and I think the dispensaries today just make it a lot easier, right? Because that's just a controlled burn. But when it comes to supplements, when it comes to other things, if you find a company you trust, stay with them, do the research, and go with it.
So no QR code, toss it.
No, I don't. Sorry.
No, I was just gonna say, like, if you know it works, that's what you stick with. And like Anna was saying, the hard part is like, what works for me might not work for Anna or might not work for Dr. Williams. So that's the hard part. So it is a lot of trial and error, I feel like, in the beginning, until you figure out what really works for you.
But
Let's talk- go ahead, I'm
I was
sorry.
going to say, companies who use third-party tests and can produce those lab results, and there's a ton of companies out there that do that, so I don't
Recording
think
in
it has to be completely
progress.
cost prohibitive. But I would highly recommend for the consumer, for the athletes, to make sure that it is third-party tested and you can see somewhere an analysis of what's in there.
How about mode of application? What are your thoughts on that? Vaping, inhaling, patches, edibles, topicals.
Well, like I said before, my biggest issue is with the smoking, like the blunt or marijuana, without a bubbler or vaping. You know, the heat, and Dr. DeSilva can probably answer this better than I can, but the heat with the marijuana, in conjunction with the cannabis, I always am concerned what it's doing to the lungs. So if I had to tell an athlete to take marijuana, which obviously I can't because I work in the collegiate setting, I would recommend they do either gummy or something like that and not smoke the blunt or the joint.
It also comes down to what you're treating. Are you doing it for maintenance and long-term health, and you're taking, a CBD gummy or a tincture every day? Are you treating acute pain, where actually smoking gets it to your system faster and will treat that acute pain? Having something go through your entire system sometimes takes too long. There are a lot of options for things that have a lower burn temperature now, and that's, I think, the new kind of wave. Actually, the NFL study, they funded $1 or $2 million for a study, which anybody in research knows that's not a lot of money for a study, but
Two of them for 1 million.
two of them for 1 million each. But one of our athletes is involved in helping guide that study and set up the kind of real world application of it. And they are using lower burn temperature products. And so then you kind of reduce some of that heat situation. Now, going into the lungs and things like that, I mean, I don't think it's like cigarette smoke, but I would defer to a medical professional to actually comment on that.
Well, I'll comment on that first. Low burn. Yes, you want low burn because you don't want to burn off the terpenes, right? Heat's going to kill off the terpenes, and you're immediately negating the effect of the full spectrum, and you want the terpenes in there. I think as far as delivery systems, I agree with you. I think, for me personally, the amount of damage that is done to the mucosal membranes when it comes to smoking, I think long-term is going to be detrimental. Because no matter what you do, any kind of a noxious agent is going to damage the epithelial cells, the lining of the membranes, and it's not going to be a good thing. That's number one. So I am not a huge fan. I mean, if you do it once in a while, Anna, I'm okay with it, right? But if you do it regularly, and I think if you do it on, let's say, every day, a couple of times a week, I think that's a problem. As far as the tinctures, delivery systems, as I said before, and in my introduction, I said I really like delivery systems. I worked on liposomes 35 years ago. I don't know if you know what liposomes are, but liposomes are lecithin sphere. They're the active ingredient covered in a lecithin sphere. So if you take an onion and you cut that onion, All of the circles in the onion are the lecithin spheres. Those are the fat spheres. In the middle is where the active ingredient is, and you can put, obviously, hundreds of millions of these into a liquid. There's also something called micellization. Micellization is a different process. That's what the body does, because when you look at oils, it's an oil. How does the body change the oil in our bodies when you take an oil into something that's soluble, which is a water? It's called the micellization process that happens through the gallbladder, through the liver, and through the stomach. So what I did was when I developed these delivery systems, I did both. So what you said, acutely, what you want to do is you want to have a product that has micelles in it, because it will get in and it will immediately start to work. You also want some liposomes with it, because now you're going to get the longer duration of that. And we did a PK study, we did a pharmacokinetic study, and what we showed was if you use the combination, you will get immediate action within 45 minutes to 60 minutes, and you will have duration up to about 12 hours. So now, after we did that study, we now know how to dose the person. We know that it's a twice-a-day dose. That's that. Topically, if you're applying something topically, and I also work with, and I've developed a luxury skincare line, and that has no cannabis in it, by the way. It's completely botanically based. What we use in our skincare line is the botanicals, but and again, you have to look at particles, size of the particles, charge of the particles, where you apply it, and how you apply it. So that's the topical. I really like topical applications. The problem with gummies, can anybody tell me the problem with gummies? In the belly. That and sugar. Anna said sugar. In order for the American palate to take something, it has to be sweet. There are three things that our palates love: is fat, sugar, and salt. That's why you can't eat one potato chip. It's got the perfect blend of fat, the perfect blend of sugar, and the perfect blend of salt. So all of those pieces with gummies, I think you're doing more damage than you are good.
Okay, I got a question for each of you here. You come from 4 completely different backgrounds. If you received a phone call tomorrow from a local high school, not the one you coach at too, by the way, I looked up your background, and they said, would you please come over here and do an educational talk for our student athletes who are 15, 18 years old on the topic of cannabis? We'd like you to do it for no more than 20 minutes, because that's their attention span. What would you focus on in those 20 minutes? As we said, education is the most important thing, and these are a group of minors who are athletes. I promised you I wouldn't put you on the spot with these questions, but I am.
What I would tell the athletes is this. I would tell them, first of all, don't buy it on the street. The second thing I would tell them is, why are you using it? I have patients who come in and say, I'm taking all of these vitamins. And I say to them, why are you taking this? Well, I saw it on TV. Why are you taking this one? Well, the guy at the gas station told me to take this. Why are you taking this one? My friend told me to take that. That's not a reason to take it. So number one, where are you getting it? Number two, what do you hope to achieve? And number three, I would focus on the dangers and the education of why are you using THC? Are you using this to get high? If you're using this to get high, don't do it, because you're going to hurt yourself and you're going to get into trouble. If you want to use something because you have if you have an injury, well, this was, and I'll come back to this, I'll answer the question first, but those are the things that I would focus on, those 3 topics, and really educate them about those 3 points.
Professor?
I'll kind of echo what Dr. DeSilva said as well. And also, we can't, at that age, I still think there's an aspect of, you know, I don't want to, yes, we know the benefits of CBD and cannabis, but, you know, at that age, you know, I would suggest why not speak to a mental health counselor first, depending on what they're using it for. Because I would think at that age it's just to, like Dr. DeSilva said, just to get high. And again, I'm just anecdotally thinking. You know, but I don't think, and if there's something that they had to take, I mean, we also, I do believe in taking these drugs under a doctor's care. And if you're gonna take them, okay, because, you know, I don't believe you should just arbitrarily just hand out these drugs to everyone. That's just my opinion. Because, you know, like we said before, it doesn't work with everybody the same. You know, like Dr. DeSilva said, you know, you don't just take these multivitamins from Walmart just to be taking them, because you can actually overdose on some of these vitamins. So, so why they need to take it? You know, I think that was my number one concern. And if they said, you know, I just like to get high, I like to, you know, hang out with my friends and, you know, party, that is the absolute wrong reason to take it. And I think that, you know, seeking the help of a mental health counselor or psychiatrist, I think that in that age, that's probably the number one thing. And then, of course, hey, what do your parents think about this? You know, do they know this? You know, so that's just my opinion.
That's a tough one because I'm a high school tennis coach, or I was. I'm not currently right now, the last 2 years. But some of the girls that I coached knew that I had used CBD, or they'd seen me maybe with Athletes for Care or something that I posted, and they'd asked about it. And I just remember feeling I was taken off guard because, well, kids pay attention to everything. And as a coach, I always feel like I'm the last to know. But when I responded, I was a little embarrassed because a lot of the girls looked up to me, and you know, in the stigma in society, you know, marijuana is bad, and they would be like, Coach, how can you play stoned? And I'm like, that's not, I take a very small amount, and I use it more to help me sleep and to calm. And you know, when I was able to explain it, how I use it for not only just for being an athlete and what all comes along with being an elite athlete, but also with my spinal cord injury and my disability, you know, a lot of muscle spasms. I have a lot of lower back pain from sitting 24/7. You know, once I was able to explain it in that realm, they really understood, and I was able to kind of take away that stigma of I'm not a pothead. But then, you know, I did ask, like, why are you guys asking me this question, or what do you know? And the thing was, well, we wanted to know, and we saw it on your Instagram or whatever, and like both these guys here are saying, I think that, you know, if there's something going on at home, or like with my girls, if they come to practice upset, or I never know what's going on, but I always think like there's other things going on outside of practice, outside of school, what's going on at home. And I think definitely like having some kind of counseling if they are thinking about it. But there's got to be a reason, like why exactly? Is it to get high and to party? Then that's not the right answer. If it's for another reason, if it's because you have a lot of anxiety, then okay, maybe that is something that, you know, I'd love to go and sit with a school counselor, and we can talk about maybe some ways that, you know, we can help ease that anxiety. But that would be really difficult, and I don't want to ever have that conversation. Just because we don't have the research today. Like, we just don't have the research, and two, they're still so young. Like, both of them are still developing. Their brains are still developing. It's not the time to be trying these kind of things either. In my opinion, I don't think until you're at least in your 20s should you.
So your message is abstinence.
Yeah.
Yeah? Any thoughts on?
I'd probably have one of these people take my 20 minutes.
This is a real issue. We talk about one of the most important things being education. We have to know what our message is if we're going to educate, because the message is different depending on the population and the age of that athlete. You know, if we just said it's not appropriate in high school, when does the switch flip? When it is appropriate. There's a question here. Do we have a microphone? It's being recorded, if you don't mind, so we can get you on the mic. Thanks.
Matt Waddell with Runners High Cannabis. So I'm possibly going to have a slightly different perspective on this, but I would speak to those students about the fact that we actually can get high naturally. I would talk to them about the the endorphin myth, and the fact that we can actually produce anandamide within our own body that does give us a high. And they can go out and access that. And my experience as a college football player and then a long distance runner brought me from a place where I never used until I was 30. And then I started using for back pain. And then I took an edible one morning and went out for a run. And I realized that this runner's high that I had been chasing for years is available quickly. And it helps people who have lost that access gain it back, rather than those students who are in the prime of their life and they can get it. So that's one way to go about it.
Thank you. I think tomorrow one of our speakers is Josiah Hesse, who wrote a book called Runner's High, and he'll tell you about his story of how, and I don't want to steal his thunder, but went from basically being a non-athlete to an ultra-marathon runner. It's a very fascinating story. I'm not sure that's the one I would share exactly if I were talking to high school age students, but this is interesting because we have experts here who all have completely different viewpoints, yet we know education is really, really important. It has to start somewhere, and you know, we're trying to educate seasoned physicians around this country on this topic who still have animosity towards the word marijuana and cannabis and anything along those lines. So we have an uphill battle with respect to that. Regardless of where people's viewpoints are, education is key. The longer you've been out of school, the harder it is to educate individuals.
Well, and I think when you're talking about 15 to 18-year-olds, you're also dealing with parental consent. You know, things that you would say to a 19-year-old, you can't say to an 18 or a 17-year-old rather, and the developing brain. And I think, you know, having a good understanding of exactly how this interacts with a developing brain, I think is a key piece of information to have as you determine what you're going to say in those 20 minutes.
You know, the controversy is sad, in my opinion, that we're even discussing this, because, again, I'm coming back to, you can take your Adderall, you can take your Zoloft, you can take your Xanax, you can use your asthma medicine. Why is that okay?
Why is that okay?
But do you want me to read the side effects? Do you want me to really read the side? We'll be here till tomorrow. If I read you the side effect profile in the PDR. I was on the advisory board of the PDR many years ago, the physician's desk reference. And we talked about all of these things. Why is it that we're still having a conversation about something that has such broad, wonderful application that is taboo? So what I'm thinking, and what I would like to offer is this, is I think we do need to do the education. I really do. And I don't think we should do this with 6-year-olds. I mean, I have a grandson who's 6.5. I could imagine saying, hey, Derrick, you know, you really shouldn't smoke pot. Yeah, I mean, he's going to look at me and say, Dad, what are you talking about? But if I had, you know, a grandchild that was, I guess, 12, 13, yeah, I would have that conversation. And again, come back to, why are you doing this? Is it because your friends are doing it? Or had you heard something from one of my lectures and you'd like to try it? And let me rephrase. I'm not talking about THC, okay? I am talking, again, I am very much focused on the full spectrum hemp oil. I'm talking about the endocannabinoid system. So should we have that conversation and clarify the difference between the two? Yes.
If you're ever having a slow day and you're in front of your television, have a pen and paper handy and just patiently wait for the next commercial for a pharmaceutical drug.
Oh, gosh.
And count the number of side effects they say that you should not have to take this drug with, right? It's the entire commercial pretty much.
Right.
Yeah.
And it's just done in such a smooth way that music and the words go by and we don't even think about what they're saying. We don't have those issues with the majority of the plant-based products that are out there, right? question, I think so, yes. Can you use the microphone, please?
Thank you. My name is Carl Bryant. I'm with a couple of different organizations. One is I'm with a BioWaste Tech Farm, which I teach agricultural, industrial hemp to children who cross the line of the law. So I own two nonprofits, and one of my nonprofits, I'm a 501c3, and the other one is I'm a 501c4. I don't know if you know what a 4 is, but the 4 gives us an opportunity to lobby and rewrite laws. One of the things that I believe to know is that children really need to come off of pharmaceutical drugs fast. But as you would say, that there's a different level. There's the people who down here who should know and can make a difference, but they're not educated to know that they can change things, fight things, understand things. And then there's the people here who, as you said in legislation, are making the money off of it, that's suppressing and just doing what they want to do at the same time. I'm a former athlete. I played collegiately, I played professionally. And you're damn right I played high and had no problem with it. So when it comes to, we saying a reaction part of it, that's just the thought process on different people, because we all react from it differently. My goal today is, I'm uniting young people. I created an organization called Young Law Legal Club, and actually I knocked down a 40-foot mobile home trailer, and I'm building a portable courtroom in which I'm getting ready to go from street corner to street corner with my Young Law Legal Club, because things has to change in legislation, and young people need to be a part of that. And so I not only educate them into the hemp prospect, but I'm also getting ready to educate them about the sports side of it, and that's why I'm here today. Thank you.
Could you one question for you as well. When you say young people, at what age would you start the education of this?
Well, I work with kids from 5 to 24, but let me just tell you, kids are even at 5, it would just blow your mind. They're very, very well versed and knowledgeable to know of all things that are taking place. So I would only go, and I'm going from 10 and up, only for the sake of those who would like, I don't think you ought to talk to them. I really don't give a damn, because we're losing them. And so, I don't know if you know this, FAMU University is teaching about the medical marijuana side, the unlawful use of okay. So I've jumped a part of that as well. And I had to go and meet with the commissioner, because I wanted to write my own curriculum at it and how to do it, because that up here is just blocking and trying to stop it. So I think this is a great thing. That's why I'm here today, because I believe the young people need to be using cannabis instead of the pharmaceutical drugs. And I just believe people are afraid to say something about it, but we're going to change that.
At our university, at Florida International University, we conducted a number of surveys that we presented at various conferences over the last 2 years. And we surveyed educators in health professions in college around the country, and found out we do what's called a knowledge and perception study. We find out that they had very little knowledge on this topic at all, and their perception remains animus and adverse towards anything cannabis. In same studies, we surveyed their own students in their own programs, who know, as I'm sure you're not surprised, a whole lot more and want to learn more and are open-minded to learning more relative to this. So the disconnect is, many people who are in educational settings grew up in an era where all things marijuana are bad, basically. And we've seen changes. We've seen changes in society on a number of fronts, from the criminal justice system to the therapeutic benefit component, and we're trying to close that gap. At some point, educational programs need to be implemented for all generations, quite frankly. I think pharmacy schools are somewhat leading the way right now. Slow integration with some medical schools, and as somebody alluded to earlier, in my work in consulting with universities, I can speak the same language from school to school to school, but their leadership and their philosophy is what determines the policies and procedures that they implement. So if they're a faith-based school, they'll have a zero tolerance policy. Others are saying this will not be punitive. This is a mental health issue, this is a therapeutic benefit issue, so it really depends on leadership where we go. But we have to have some form of some consistent education at all different levels. It's a different type of education for different levels of individuals, but that starts with educating the educators. Until they're educated, we're not going to be able to educate people formally within the systems. Dr. Gordon.
Understand that parents will bring their teenagers in for the visit these days, right? And sometimes it's the valedictorian of the high school class. And you're right, there's always an innate anxiety, right? But you have to understand these kids are coming out from behind the mask for 2.5, 3 years. COVID has affected everybody. Plus, this is a different generation. I just turned 66. So I'm about 4 generations past this group now. They've carried a cell phone around in their pocket every single day of their life. That's a cortisol buzz that we didn't get when we grew up. They've had to duck and cover under their desks for school shooting drills. When I ducked and covered, it was over a nuclear thing that you never knew was going to happen. So my philosophy, guys, in 2022, I'll have to come at you entirely differently. Abstinence doesn't work. Never has, never will. If you come at these kids with abstinence, they're going to end up binge drinking. They can run into a single occurrence overdose to death now, which didn't occur during my day either. People are fascinated when I tell them my first 16 years of my ER career, I did 6 combined narcotic overdoses in the entire 16 years in Northeast Ohio, big cities. Heroin was around, but people didn't die from it. The heroin addict knew what they were doing. There weren't pills out there, nor was there carfentanil. Now, there's single exposure overdoses out there, and we hear it every day. Even in the cannabis supply, believe it or not. And I hate to be urban myth guy, but there's been 2 cases in Florida where there has been fentanyl on a baggie or in the cannabis after the joint was rolled. The lick was made. Mucosal exposure has killed 2 people here in Florida. I've seen the case reports. So you need to be a safety officer too. So that's my comment. People are coming in looking for safety. They're looking to feel the best they can, the most natural way they can, and to be legal in doing so. So to me, you have to engage in the appropriate education with each student. Under 25, absolutely brain development comes into every single discussion that I have with a parent and their child, every single one of them. And my recommendation is always to start on a CBD combination THC product every single time. So to me, that critical aspect of medical comes into play even more so with that under 25, population. But I don't think you can deny them their desire to find some alternative to alcohol, Klonopin, Ativan, Adderall, Vyvanse, Ritalin on the other side. Parents actually bring kids in looking for a safer solution these days.
Dr. Gordon, I'm in your camp relative to abstinence isn't the solution for education. I think abstinence is the solution with respect to safety and to understand where they're getting their products from because of the dangers relative to that. I don't care what age you are, you need to understand what you're getting, where you're getting it from, and what you're putting in your system. But abstinence didn't work with sexually transmitted diseases. It didn't work with heroin addicts. We give them needles, we give them condoms, we do all these different things. And the minute you say the word don't do it, or the phrase don't do it, it's almost a challenge to individuals or to not listen to you. I've walked into many rooms with teams of student athletes, and it is not possible to look at them in the eye and say, don't do this at all. It's just not possible. If you can educate them on timing, dosing, moderation, why are you doing this, as you said earlier, what are the therapeutic benefits that you seek, and then better help them understand what they should be using and when, then I think we're headed in the right direction. But that's a big part of, the lack of education of what's out there to help people understand where there are benefits and where there are risks. We're winding down here. We have just a little bit over 5 minutes left. So what I'd like to do is essentially head down the panel and ask each of you to take a minute or so, maybe with a closing remark on what you'd like to leave each of us with. Anna?
Well, I'm really happy to be here. Thank you guys so much for putting this together. I think, so this is the first ever conference dedicated to the use of cannabis in sport, completely focused. We go to conferences all over the world and we talk about this. We talk about, using cannabis for performance, for health, for fitness. And this is, it's a 1 hour blip in a 3-day or week-long session. So I just really commend you guys for doing this, and I'm excited to be a part of it. And I just want to thank you guys all for being here too. I'm honored to be speaking to you, and I look forward to getting to know all of you. And I don't really have any good nuggets, so I'm gonna.
Thank you.
I just also want to say thank you. I really appreciate the opportunity to share, what I've been doing for 35 years. I think education is the key. I think we need to start, as you said, with the top, because if the top doesn't understand, and if the administrators in a hospital or the medical directors of a program don't understand and don't appreciate what this really does, I think you're fighting a losing battle. I'd like to just share one thing that I brought with me. This is, as I said, I'm an internist, so this is Internal Medicine News. That's the cover. Internal Medicine News, the July issue. I just got this. On the second page, cannabis may relieve pain as effectively as opioids, but more studies are needed, research says. This is what you will always see. You will never see something that says cannabis may relieve pain as effective as opioids, and it stops there. You will never see that. It always says but more studies needed, researchers say. Seriously? How much more study do you want? There are books and volumes. Do a search on PubMed with full spectrum hemp oil and pain. 5,000, maybe more citations?
24,000.
Okay, 24,000.
Just did it.
No, it probably is 20. It's
Yeah.
probably 24. You want 24,000 more? Okay, we'll keep doing it. At what point are you going to believe it? So I think we really need to, and I've spoken at our hospital at Grand Rounds, I've spoken to the medical residents, they rotate through my practice, and they believe. At the end, I think it comes down to, here's the science, here's what you need to use it for, we're not getting high with this is great for you, depression, PTSD, et cetera, et cetera, et cetera. I don't need to repeat all of that. If we start with education, I think you will be successful. 35 years ago, I'll never forget this story. I was making rounds. I was on the 3rd floor of our hospital, and I was clearing a patient for surgery. I'm a 30-year-old attending. And the chief of surgery comes up to me and says, Derrick, I have a question for you. He literally took my arm and walked me into a closet. I thought, oh, Jesus, I really am in trouble. I've been here for a year, and I'm in trouble already. He said, I've got a problem with my cholesterol, and I don't want to take a statin. What can I do? It's the same thing today. It's the same thing today. People are taking you into a closed room and asking you a question when the question should be asked in front of everybody.
All right, well, thank you all I just want to say thank you all for all attending. Thank you again, Dr. Konin, for the invite, and thanks to the Cannabis Sports Medicine Conference for the invite as well. I'm a believer in cannabis, especially the non-THC, without the THC, as far as athletics. I will say I don't think it's the end-all, be-all. I don't. I think it's great for some, but I don't think everybody should just, take cannabis. I don't. I think there's other ways, because like we all said, it affects people in different ways. So I don't think we can just arbitrarily just throw out this drug. Okay, this Vicodin may does this for you, but it does this for me. So I think it should be under a doctor's care. I don't think it should be just something you can get off the street, all right? But I think long as it's under a doctor's care and the doctor or your physician deems that that's what's going to be effective for the both of you, I think then I'm all for it. But I also do believe that there's other aspects that could be, looked into as well. It depends on what your conditions are.
I just want to say thank you to Athletes for Care for inviting me to be here to speak. And the Cannabis and Sports Conference, it's really an honor to be here and share my story. As a person with a disability, and I've been paralyzed from the waist down since I was 7 years old, and I've had to take medications my whole entire life, and up until 2016 when I decided that I was going to try the medical marijuana route. I literally want to scream to on the rooftops and just yell how amazing this drug has seriously changed my life, and just how much better I feel, how much clearer my brain is, how much better I feel as a person. I feel like I'm living my life fuller now than I ever have. From the bottom of my heart, I just want to learn so much more about this. I want to learn how that I can educate others as an athlete and as somebody that I know a lot of youth look up to. I'm looking forward to learning a lot from this conference this weekend so that I can share the things in the right way, to be able to share with our youth and with our adults and with all the people that I serve with varying disabilities. I just have a story. That's all I feel, and I would love to learn more and get more education behind it to be able to back up what my story tells. And like Dr. over here, you said that you showed their, what it says here in the article about there needs to be more research, right? I mean, I don't know how many more people need to tell their story. Thousands of people maybe need to tell their story, but I just know it works. It's worked for me. It's changed my life, and that's what I'm going to end with.
Thank you.
Thank you.
There's three key words that came out of this for me this morning or this afternoon is research, education, and influence. The influence has been pretty powerful. That's been the N of ones, the patients all over that have had a voice that have led to legislative changes and belief and telling their story. We've talked about the education and how important that is, and we mentioned the research. What we need to see changed is the scheduling, number one, of the drug so that we can do clinical trials, and then the scheduling, that educational piece, for example, in universities where institutional review boards are free to approve studies with THC in it of any kind. So even if it's hemp-based and they see 0.0009 of THC, they'll say no. In fact, studies now are being turned down that are CBN-based. And then, of course, we have Delta 8 loopholes, many more things to talk about. But in the future, I think those are the three key things. Continue the influence, increase the education factually, because there is a lot of bad education out there, and then see the landscape change so we can actually do some clinical trials to convince the medical and the health professionals. I want to thank all of you for being here. You can look around the room at each other. You are here at the first and the inaugural first of many Cannabis and Sports Conference, hopefully, and we appreciate you being here and participating. I especially want to thank each of you on the panel. Gene Jones, our conference organizer, put a rock star badge on me, but all four of you are the rock stars, honestly, for being here and participating in the very first panel of this conference. So thank you very much, and this will conclude our first session. Thank you. And now that we're not recording, we'll roll into the social. Is that correct, Gene? Okay, great.